Hey guys, this is Naudi of Functional Patterns, and today we're going to be covering a gluteus medius release with the lacrosse ball. This is going to be especially important for people who have lower back problems, who have hip problems, or who even have knee problems, as they do tend to affect the way that your body distributes its weight from one leg to the other. So getting into this trigger point will be absolutely important towards addressing those issues. We're going to lie down on one side of our body. This elbow is going to be down. Then from there we're going to put this hip into flexion. This leg's going to come on top of the other. Then we're going to bring that lacrosse ball and bring it underneath that hip right there. From there, I'm just going to slightly rock it back and forth until I end up finding the most tender area, and then I just hang out there. So for those of you who have an asymmetrical shift, this is going to be absolutely important, because it's usually that gluteus medius that ends up kind of piking up one hip over the other, and that's what usually leads to one side of your body shifting more so to the other. Now for me personally, this isn't really that big of a problem anymore, because I have been doing this for the last few years and I practice it on a regular basis. So if you do this enough, within time that asymmetrical shift will change, and then from there you should be able to balance it out. Most people with hip pain and lower back issues usually end up having an asymmetrical shift. So getting at the root of that is going to be absolutely imperative. We'll switch sides. Once again, this hip is going to be flexed. Hip is flexed. I bring this foot on top of the other. I'm down at my elbow. I grab the lacrosse ball, bring it underneath that gluteus medius region, and I just move it around until I find a nice tender area. And again, we chase after the pain here. We don't want to kind of like shy away from something that's going to hurt us. Pain is usually going to equal gain in this. Too much pain may not equal gain, so you kind of have to calibrate what's going to be tolerable for you. If you feel like a lacrosse ball is too much and that it's just too intense, I would recommend getting regressing down to a tennis ball, and that should work out just fine to get you introduced into a lacrosse ball. All right, guys. That is a gluteus medius release that's going to help you with your asymmetrical imbalances. If you would like to learn more about what I do, I would highly recommend you go to functionalpatterns.com or subscribe to my channel, and I'll have plenty more information for you guys. Take care.